You know that feeling when a problem just feels sticky?
Uh-huh.
Like you keep trying different things, but the core issue, it just stays hidden. And you're not really sure where to even start digging.
Absolutely. It's like trying to untangle a really knotted piece of string you pull here and there, but the main knot just seems to get tighter.
Exactly. Well, today we've got, I think, a fantastic tool to talk about, something really designed to help us get to the heart of those tangled problems.
Okay.
We're going to take a deep dive into the Fishbone Diagram. You might also hear it called the Ishikawa diagram, or maybe a cause and effect diagram. Think of it like your personal X-ray for problem solving. It helps you visually map out all the potential things contributing.
That's a great way to put it, actually. It's about creating a structured visual map of the issue, right? And all the different elements that could be playing a role.
Right.
It makes it so much easier to see the bigger picture and, maybe spot connections you might otherwise miss.
And this isn't some, newfangled technique, is it? It's got a bit of history.
It really does. The Fishbone Diagram, it was developed way back in the 1960s.
60s, wow.
Yeah, by Kaoru Ishikawa, and it was mainly for quality control in industrial settings initially.
Okay.
But the thing is, its strength is its versatility. It's proven incredibly valuable across, a huge range of industries. And it's definitely made a big impact in healthcare, which we can get into.
Yeah, definitely want to talk about that. So for this deep dive, then, our goal is really to understand what is a fishbone diagram and explore why it works so well for getting to the root of problems. And then, let's look at a concrete example in healthcare to see it in action.
Sounds good.
Okay, so let's get started. When we talk about a fishbone diagram, what are we actually picturing? What does it look like?
Okay, imagine the skeleton of a fish, sort of laid out flat horizontally.
Right.
The head of the fish, that's usually on the right side, and that represents the specific problem or effect you're trying to figure out.
The main issue.
The main issue, exactly. Then, coming off the spine to the left, you have these main bones, and each of those bones represents a major category of potential causes, things that could be feeding into that problem.
Okay. So it's not just like a random brainstorming session then. There's a definite structure involved.
Absolutely. That structure is key. It really forces you to think systematically, to consider different angles of the problem.
Instead of just latching on to the obvious thing.
Right. Instead of just focusing on the surface symptoms, it guides you to explore a much broader range of potential causes, and it keeps them organized logically.
And those categories, the bones branching out, that's where that structure really helps. Yeah, they act like sort of buckets for your ideas.
Precisely. By using predefined categories or even ones you customize yourself, the diagram makes sure your brainstorming is more comprehensive, more organized.
Right.
It helps stop you overlooking whole areas that might actually be contributing to the problem.
Because it's so easy to get fixated on what's right in front of you, isn't it? You see one symptom and think, that must be it.
Exactly that. And the fishbone pushes you beyond that first reaction. It encourages you to keep asking why for each category.
Digging deeper.
Yeah, peeling back the layers to uncover those, underlying factors, the things that are the true drivers of the problem.
Now, I think I remember reading there are some standard categories often used, especially back when it started in manufacturing.
You're right. The traditional framework, particularly in manufacturing, often uses the 5 M's.
The 5 M's.
Yeah. Manpower, that's the people involved. Yeah. Then machines, methods, so the processes, materials, and measurement.
Okay.
They give you a really useful starting point for looking at causes in, say, a production environment.
Okay. Manpower, machines, methods, materials, measurement. Makes sense for a factory.
Yeah.
But what about the kinds of challenges people face in other fields, like the one I might be dealing with at my desk, maybe not in manufacturing? How do those categories change?
That's a really critical point. While the 5 M's are a good foundation, the real strength of the fishbone is how adaptable it is.
Right.
The categories should always be tailored to the specific problem you're looking at and the setting it's happening in.
So make it relevant.
Exactly.
Yeah.
In healthcare, for instance, you might use categories like people, staff, patients, families, perhaps, processes, clinical pathways, admin procedures, environment, the physical space, but maybe also organizational culture.
Okay. Culture fits there too.
Yeah. Then maybe policy rules. guidelines,
Yeah.
technology equipment, IT systems, and material supplies, meds.
So it's really about picking categories that fit the context of the problem you're trying to solve. It's a flexible framework.
Totally flexible. You might even use things like staff, systems, space, supplies, support processes, whatever makes the most sense for your situation.
Okay.
The goal is just to choose categories that help your team think broadly, inclusively about all the potential causes.
This sounds like it could be a really powerful way to get different people, different teams seeing the same picture. So if I wanted to actually sit down and do one, put a fishbone diagram together, what are the basic steps?
Well, it's pretty logical, actually. The absolute first step, and it's crucial, is to clearly define the problem. What exactly are you trying to address?
Get specific.
Yes, that becomes the head of your fish. The more specific and well-defined it is, the better your analysis will be.
Makes sense. Vague problems probably lead to vague diagrams, vague solutions.
Exactly right. So once you've got that clear problem statement, then you identify the main categories of potential causes, those main bones we talked about.
Right, the buckets.
Then comes a brainstorming. For each category, you and your team just generate as many potential causes as you can think of that might be contributing.
And just get everything out there. No bad ideas at this stage.
Precisely. Encourage everyone to chip in freely, no judgment, just capture everything initially. After you've got all those ideas, you organize them. You link these potential causes as smaller bones coming off the appropriate main category bone on your diagram.
Building out the skeleton.
You got it. Once the diagram feels complete, the next vital step is to analyze it. You look for patterns, you discuss which causes seem most likely or maybe have the biggest impact.
Maybe gather some data.
Yeah, you might need to investigate further, gather data to confirm things.
Okay, and then, once you think you've pinpointed those likely root causes,
that's when you shift into developing targeted action plans. You create specific, measurable steps to tackle those root causes.
to stop the problem coming back.
Exactly, because without that action plan, the fishbone diagram is just, well, an interesting picture. The real value comes from using it to actually drive change.
Okay, let me see if I've got this. Define the problem clearly. Pick relevant categories. Brainstorm causes within each. Organize them on the diagram. Analyze to find the key root causes. Then develop actions to fix them.
That's it, a really clear sequence.
So what are the big advantages then? Why go through this process?
Oh, the benefits are pretty significant. First off, it leads to a much, much deeper understanding of the problem.
Right.
By systematically looking at all the angles, you're way more likely to find the actual root causes, not just slap a Band-Aid on the symptoms.
Which means more effective solutions.
Naturally.
Yeah.
More effective, more sustainable solutions. You're fixing what's actually broken.
Okay.
Another huge advantage is teamwork, collaboration. The visual nature of the diagram gives everyone a shared framework.
Something to gather around.
Exactly. It encourages people from different areas to contribute their perspectives, work together, and build a common understanding of the issue. It can really help break down those departmental silos.
I can see that.
And of course, because you're focusing on the root causes, you're much more likely to prevent the problem from just cropping up again later.
Reducing recurrence.
Yes. Plus, often the whole process can shine a light on areas for broader process improvement, things you might not have even been looking for initially.
So it's not just about fixing this one specific thing. It can have knock-on benefits, improving overall efficiency or quality.
Precisely. It really promotes a culture of, continuous improvement, learning within the team.
Okay, this all sounds great in theory, but let's make it really concrete. Can you walk us through a real-world example, maybe in healthcare, to show how this actually gets used?
Sure. Let's take a common headache in hospitals. Delayed patient discharges from a general ward.
Ah, yes, I've heard about that being an issue.
It really can be. Leads to bed shortages, higher costs, not great for patient experience either. So, delayed patient discharges, that's the head of our fish.
Got it. The problem.
Now, let's think about some relevant categories or main bones.
Okay, where would we start? People seems like an obvious one.
Absolutely. Under people, we might brainstorm things like maybe staff aren't always aware of the planned discharge dates, or delays in doctors doing their final checks and signing off on discharge orders.
Communication issues between teams, maybe?
Good one. Lack of communication between different care teams involved. That definitely fits under people.
What about the actual steps involved, like processes?
Definitely a key category. Under processes, we could ask, are standardized discharge checklists being used consistently? Are they even effective?
Right.
Is the process for ordering, say, Final medications or special equipment efficient? Are there bottlenecks in coordinating transport or setting up follow-up care?
Lots to consider there.
Yeah.
What about the physical environment? Resources, maybe environment.
Yes. Under environment, you might think about pharmacy staffing levels. If they're short-staffed, does that delay getting meds ready?
Makes sense.
Or maybe delays in getting necessary equipment to the patient's room or arranging transport within the hospital itself.
Okay, and what about the rules?
Yeah.
The way things are supposed to be done? Policy.
That's an important one, too.
Yeah.
Under policy, we could look at whether the actual criteria for discharging a patient are clear. Are they applied the same way every time? Does everyone understand them?
Consistency.
Exactly. Or are there maybe administrative hurdles, insurance processes causing holdups?
And the tech they use, computers, systems, technology.
Perfect. Under technology, maybe issues like delays in updating the electronic medical record, the EMR, to show the patient is ready to go.
Right.
Or maybe the system doesn't have good alerts or reminders to prompt staff to complete discharge tasks on time.
And the actual stuff needed, like paperwork, supplies.
Materials.
Precisely. Under materials, we could think about the availability of discharge summaries. Are they ready when needed? Patient education leaflets? Any specific supplies the patient needs to take home, like a discharge kit?
Okay, so you'd have these main categories: people, processes, environment, policy, technology, materials. And then for each one, the team would really dig in and list all those specific potential issues that could be causing the discharge delays. Exactly. And once you have all those potential causes mapped out visually on the fishbone, the team can then look at it all together, maybe use data they have or do a bit more digging to figure out which of these things are the biggest drivers of the delays.
So you can focus your efforts.
Right. Allows them to focus their improvement efforts on the areas that are going to give them the most bang for their buck, so to speak, in speeding up discharges.
That really clarifies how you can take what seems like a big, messy problem and break it down into, well, manageable chunks.
Yeah.
Areas you can actually tackle.
Yeah, it makes it much less overwhelming.
Now, we're lucky to have some perspective from Dr. Surta Ram Vishnoi from Supremediq Consultancy, PVT, Ltd. They work a lot in hospital strategy and quality, right?
That's right. Extensive experience.
So what insights does Dr. Vishnoi offer on using fishbone diagrams in practice?
Well, Dr. Vishnoi and the team at Supremediq often recommend the Fishbone Diagram. It's a key tool they use in quality improvement workshops with hospitals. They've found it's incredibly effective for helping healthcare teams uncover those sort of hidden factors, the less obvious things that still contribute significantly to problems.
Like what kind of problems?
Oh, things like optimizing patient flow through the hospital, improving infection control practices, even making staff training more effective. The diagram helps identify the bottlenecks or underlying issues.
So it's a real go-to method for them for digging beneath the surface, finding those hidden roadblocks to better care.
Precisely. And Dr. Vishnoi really emphasizes something crucial for making it work well. You need active involvement from interdisciplinary teams. Meaning bringing together not just the managers or administrators, but the frontline staff, too.
People doing the job day to day.
Exactly. The nurses, the doctors, the therapists, the support staff, people who are directly involved in the processes, their firsthand experience is absolutely invaluable.
Because they're the ones who actually see where the system hits friction or where things break down in reality, not just on paper.
Absolutely. Their practical, on-the-ground knowledge can really bring those potential causes on the diagram to life. And that often leads to identifying solutions that are more practical and actually sustainable in the long run.
That makes a lot of sense. This all really brings it back to you, our listener. If you're grappling with some kind of persistent challenge, maybe in your work, maybe elsewhere, the Fishbone Diagram offers this structured, visual way to dissect it. What are the key things you'd want someone listening to take away from this deep dive?
I think the fundamental idea is that fishbone diagrams give you that vital visual structure, a framework for understanding the often many factors that can feed into any problem you're facing.
Okay.
It really pushes you to move beyond the simple, obvious explanations and take a more comprehensive, more holistic view.
So if someone's listening right now and maybe a particular tricky problem at work has just popped into their head, what's a practical first step they could take just to try this out?
Honestly, I'd encourage you just to visualize that basic fishbone shape. Think of your problem, that's the head.
Right.
Then just brainstorm a few broad categories that seem relevant to your situation. Maybe it's about the people involved, the steps you follow, the tools you use, the environment.
Just start sketching it out.
Exactly. Even just jotting down some initial thoughts under those categories can be surprisingly revealing. It helps you start to see the different pieces involved. You don't need fancy software or anything to just begin exploring.
And it really feels like this kind of structured problem solving fits perfectly with the bigger picture goals in healthcare, doesn't it? Thinking about quality, patient safety, organizations like JCI, Joint Commission International, or NABH in India.
Oh, absolutely.
They're all about this kind of continuous improvement, right?
Definitely. Both JCI and NABH place a huge emphasis on building that culture of quality improvement, of ensuring patient safety within healthcare, and tools like the Fishbone Diagram. They're directly aligned with those goals.
How so?
Well, they provide a systematic way, a methodology for identifying where improvements are needed and then developing evidence-based solutions to actually achieve higher standards of care.
Yeah, I was looking at JCI's mission. It's about enabling and affirming the highest standards of healthcare quality and patient safety for all. And NABH aims to set benchmarks for progress of the health industry. And it seems pretty clear that understanding and fixing those root causes is fundamental to hitting those kinds of targets.
It's absolutely foundational. You really can't elevate the quality of care or make the environment as safe as possible for patients without deeply understanding the underlying factors that influence those outcomes.
Right.
And the Fishbone Diagram, it's a practical tool, it's accessible, and it really empowers teams and individuals to get that understanding.
So maybe the final thought for everyone listening is, as you tackle your next complex challenge, ask yourself, are you seeing the whole fish?
Good question.
Are you looking past the obvious symptoms to really grasp that intricate web of things that might be contributing? Maybe adopting a more structured visual approach like the Fishbone Diagram we've discussed could lead you to more effective, more lasting solutions. Definitely something to think about.